Hello, I am Dr. Kodlady Surendra Shetty, consultant spine surgeon at Spine Care and Ortho Care Hospital, Magdi Road, Rajaji Nagar, Bangalore. Cervical myelopathy is if there is a pressure on the cervical spinal cord. Cervical spinal cord is from the base of the skull to the C7 vertebra. So, the spinal cord which runs in between, that is called the cervical spinal cord. So, if there is a pressure on the cord because of the protruded disc from front or hypertrophied ligament from behind. So, if there is a pressure, sometimes it is both. There will be a protruded disc as well as hypertrophied ligament. So, the nerve or the spinal cord gets jammed between these two and there will be weakness or the swelling of the spinal cord. So, that is called cervical myelopathy. In that, the patient will have tingling and numbness in hand, one or both the hands and in both the legs. So, there will be gradual development of weakness in the hand, forearm or arm and or the shoulder muscles as well as weakness in the leg muscles. Patient finds difficult to walk. So, initially he will have a swaying gait like a drunken gait. So, and later he may develop too much of spasticity so that he will not be able to stand straight on the ground. And if this progresses further, then he will have difficulty in micturition, in passing urine, and in defecation, in passing stools. This has to be treated at the earliest because the results are better when we do early intervention, and the results will not be that good if it is a late stage disease. The treatment is usually surgical. So, if there is a disc involvement, we have to remove that disc and make space for the spinal cord, or sometimes there will be multiple discs. So, we have to remove the multiple discs, or sometimes we have to remove the bone in front of the spinal cord, or sometimes we make a window in the back of the spine so that the spinal cord has got enough space. So, by doing this, we can improve his neurological condition. Ultimate results will depend upon when did we intervene. Suppose if we intervene early and the symptoms are not that severe, and then the results will be better. Suppose if there is a surgery is done at a later stage when there is already some amount of nerve damage, then we cannot expect 100% result, but we can expect to have some good results.